Okay, sorry, the last DVD cut off on us. I got to make sure it's working. And it is on page 8, nutrition, hydration, number 18. Bread, cereals, rice, and pasta. They should have 6 to 11 servings per day. Vegetables that are listed there, anywhere between 3 and 5 servings a day. Again, we'll get more specific when we get into the home health aid class, but this would include like cooked vegetables, casserole, fresh vegetables, salads, stuff like that. Fruits, 2 to 4 servings a day. Milk, yogurt, or cheese, 2 to 3 servings a day. The meat, poultry, fish, dry beans, peas, nuts, eggs, 2 to 3 servings a day, which is all has to deal with protein. Most patients that are elderly, they need that if they have sores on their skin to rebuild tissue. They need that extra protein. Also to rebuild muscle if they're going through therapy to try and get some muscle strength. F is fats. Those should be limited to 3 to 5 servings per day. And letter G, meal times. Every patient will eat at different times, but our service mostly tends to stick to the following times: 9 a.m. breakfast, 1 p.m. lunch, 5 p.m. dinner, 9 p.m. bedtime snack. That also runs with normally the patient's medications. If they take something 4 times a day, it's 9, 1, 5, and 9 with their meals. H, as far as leftovers go, you make a meal for a patient, there's food left over, what do you do with it? Well, we do have a policy on that. Once a meal is cooked and there's leftovers, they're to be covered and placed in the refrigerator. They are to be dated, and they can only be used for 3 days. On the 3rd day, if they're not used, they must be thrown away. On day 4, you can't use them. Day 5, you can't use them. We're here to prevent them from getting some type of food poisoning. If something is in the refrigerator that is expired or is a leftover past 3 days, or it's undated in a leftover container, it is to be discarded. If the patient or family gives you a hard time about that, pick up the phone and call, because it's a patient safety issue. And if you've ever had food poisoning, trust me, you don't ever want to get it again your whole life. I, hydration. Not only foods, but fluid. Fluid is extremely important. 80% of our body is water, fluids. So as far as hydration goes, 6 to 8 glasses of liquid a day is important. This is the normal adult recommendation and will help prevent dehydration, constipation, and infections. New studies out are recommending even a little bit higher than that right now, but 6 to 8 is fine. If you're at a patient's house and they're not getting 6 to 8 glasses of fluid a day, and 1 glass is 8 ounces, then you need to let the office know, because that patient could run into some serious problems. Okay, on page number 9, at the top, number 19, transporting patients. That only occurs in the patient's or the family's vehicles, not ours, and that's for liability insurance purposes. A, doctor office visits. There are times when we will assist patients to their doctors, sometimes with the family, sometimes we'll go by ourselves. If you are assisting patients alone, we recommend that you go into the room with the patient and the doctor, if the patient will allow you, because they're going to give you information to take back to the family, and the doctor's going to be asking you questions. Most of the time, patients cannot remember what the doctor said, so you can remind them if you're present during the visit. Call the office ahead of time if you're aware of the patient's doctor's appointment. That should be called here. We do keep record of those. And then call on the day of the appointment before you leave, and then you have to call the office when you get back. So again, there's a lot of communication that takes place there, but it's for safety purposes. B, grocery store. That's to be done only if the patient is with us, or if you call for permission to go without the patient. Shopping is to be done at the closest proximity of the patient's home. If you have someone that lives in Waynesburg and they want you to go all the way to Dunbar to go to Peachins, I'm sorry, that's not our policy. Our policy is the closest grocery store to your home. That's where we shop at. You again must call before you leave, and then you must call when you return. We are not permitted to handle the patient's money. They must set up an account at their local grocery store or provide you with a check that's filled out except for the amount of the purchase. You must then provide a receipt along with the materials that you purchased to the client upon your return. Shopping is only permitted during your regularly scheduled hours in the patient's home. It is not to be done on your personal time. Out of all the patients that we've serviced over the last years, I would say less than a handful have we actually taken grocery shopping. I prefer that neighbors do it for them, friends, or even family members do their grocery shopping. That's just less that we have to worry about and keep track of. Number 20, home management whenever there's a disease present. There's times when your patient will be sick, and you need to have an understanding of illness and techniques used to prevent the spread of those diseases to others or those illnesses to others. A microorganism. Microorganism is a tiny living thing that's so small it can only be seen with a microscope. Examples are bacteria, virus, protozoas, and fungus. B is disease. Disease is the result of an actual infection in a person's body. It's caused by one of these microorganisms, and the signs and symptoms are present, such as a cough with a green or yellow sputum, maybe burning whenever they urinate, maybe a patient that has fever, that would be a temperature over 101, that would be reported to the office. If the patient has chills, if they are shaky, like tremors, if there are red or hot or swollen areas on their skin somewhere, that could be a sign of like a cellulitis, or if they complain of pain somewhere, maybe an earache, maybe their sinuses, a headache. Those are types of things that need to be reported. C is communicable diseases. Those are diseases that can be spread from one person to the next. That's what it means. That's what that word means, communicable. It can be spread, passed along. Special precautions need to be followed to decrease the chances of these diseases spreading. Letter D, the 4 routes of microorganism transport. There's 4 ways that the microorganism can get from one person to the next to cause an illness. First is contact. That's direct physical contact, person to person, shaking someone's hand. 2 is a vehicle. A vehicle is either food or water that's been contaminated by that microorganism. Number 3 is air from a droplet or dust, such as when someone coughs or whenever they sneeze. And 4 is a vector. A vector is a certain living creatures, such as insects, that can transmit illnesses or disease. Washing hands, again, we've said this once, we're going to say it again, it's because it's the most important thing. It's to be done when you first enter the patient's house, before you make a meal for the patient, after toileting, either yourself when you go to the bathroom or when you help the patient to the bathroom, before and after simple wound care, because you don't want to have dirty hands touching a clean wound, and then once you're done with the wound, you don't want your hands to be dirty from touching the area around that wound. It could have bacteria. You wash them before you cleanse the wound and treat it, and you wash them after you have cleansed the wound and treated it. And last, excuse me, before you leave the patient's house. That's extremely important. I've said it before. You don't want to take any of this stuff home and give it to your family members. The hand washing, the time that you are scrubbing with soap should be 60 seconds. Letter E, cleaning dishes. If you're in a home, the patient is ill, how do you get the illness, the bacteria killed on the dishes and utensils that they're putting in their mouth? You use 1 tablespoon of bleach in the final rinse water, and that kills bacteria. You fill up the one side of the sink with water, put a tablespoon of bleach in it, and you just dip them in it and let them air dry. Air dry dishes are more sanitary than dishes that are towel dried and put up in the cupboard. F, disposal of liquid waste either in the commode or double bagged in the regular trash. G, use of gloves, and that's again whenever there's possible contact with blood or body fluid. H, use of a mask. Masks can be used by either the employee or by the patient. and that's to prevent the spread of respiratory bacteria. You're going into a patient's house, you've got a cold, you want to wear a mask, we have them here at the office. All you have to do is stop and pick up one. You can stop at your local pharmacy and pick up one. There are some patients that have went through some types of chemotherapy treatments or bone marrow transplants. Their white blood cell counts are low, they drop down. You may be required to wear a mask. Even though you don't have an infection, just your normal bacteria could actually cause that patient to get sick because their white blood cell count is so low. That's a possibility. Use of tissues. When an employee or patient is coughing or sneezing, those tissues should be used. And this all goes along with the next section, which is infection control precautions in the home. Hand washing. Use soap and water. Scrub for at least 60 seconds. Here it says 60 to 90. Again, it's done when you enter the house, before you leave, before meals, after toileting, before and after wound care. Gloves. They are to be worn only when there's a risk of contact with blood or body fluid. Hands are to be washed when gloves are removed. C. Moisture-resistant gown. That's used only if irrigating wounds by a registered nurse, or if there's splashing of blood or body fluids that may occur. And that's not something that home health aides are permitted to do. So they should. There's a very, very, very slim chance that you would ever have to wear a moisture-resistant gown. D. Isolation and reverse isolation. That's used if the patient has a communicable disease, or if the patient is susceptible to acquiring a communicable disease. Say the person had tuberculosis and we're in there taking care of them. They would be considered to be in isolation. The patient would actually wear the mask whenever we're in there caring for them to make sure that none of those droplets were to come across onto us. E is cleaning and disinfecting solutions. These are really good. Everyone knows about Lysol and that it does a really good job of killing 99% of all bacteria. But what if you don't have Lysol in the house? Well, there's other things in the house you can use. You can use rubbing alcohol. You can use it straight, not diluted, and that kills germs on the surfaces of everything. Medical equipment, countertops, appliances. In the home of your patient, if there's a communicable disease that's present. Second thing you can use is normally found in the laundry room, just some bleach. But you want to dilute it 10 to 1. You pour 10 cups of water and 1 cup of bleach. And if you don't need that much, you can put 10 tablespoons of water and 1 tablespoon of bleach, as long as it's an equal ratio of 10 to 1. It's also used as a great and inexpensive disinfectant. It should readily be found in every patient's home. Number 3, vinegar solution. It's also a good disinfectant. It's also found in a lot of homes. Depending upon the percentage of vinegar, there's 3%, 4%, and 6% vinegar. It would be a half a cup of all of those, and that's a type error. It says 5.2 of a cup. That's actually a half a cup for B. Half a cup of 3% vinegar, 3 cups of water. Half a cup of 4% vinegar, 4 cups of water. Half a cup of 6% vinegar, 6 cups of water. That's called specific name for that. I can't think of it right now. But that vinegar solution works extremely well in killing bacteria. A lot of patients will use this on their respiratory equipment because it works well on respiratory equipment. And then they let it sit out and dry, like their nebulizer. And then the next day when they go to use it, it's dry. It kills the germs inside of it so they don't keep getting respiratory tract infections. Number 4 is hydrogen peroxide, 3% and 6% strengths. That kills bacteria that does not require oxygen to live. So if you were to use bleach or vinegar on something, you could also use hydrogen peroxide on it because that kills a different type of bacteria than what those kill. And last we have listed is Lysol spray. Not only is it a great disinfectant, but it smells great too. Okay, and number 22 on page 10. The different body systems, they have them listed here. I'll read those. There's A through J. A is the skeletal system. B is your musculatory system. C is your nervous system. D is your skin or your integumentary system. E is your circulatory and lymph system. F is your respiratory system. G is your urinary system. H is your endocrine system. I is your digestive system. And J is your reproductive system. All these systems comprise of what makes up the body and how it works. All of these systems have to be working well for a patient to do well physically. Well, when one of these systems aren't working, it could affect all the other systems. So if we look at the skeletal system, A, it says there's over 200 bones and joints and it provides support for the body. What kind of diseases actually affect the skeletal system? Arthritis, Paget's disease, bursitis, and gout. If you are in a patient's home and on their face sheet where it has all their information, it has their medical diagnosis is listed, that's where you'll see these diseases that affect these types of systems. The B is the muscular system. There's over 300 muscles in the body. It provides movement of the body. There are voluntary muscles that you can control, like your arms and your legs and your neck. There's also involuntary muscles that control themselves, such as your heart or your diaphragm when you're breathing. C is the nervous system. That is the message center of the body. Impulses are carried to and from the brain, including your sense organs as well. Diseases that affect the nervous system are cataracts, which would affect the eyes, multiple sclerosis, that affect the nerves going to the muscles, epilepsy, which is a seizure disorder, Parkinson's disease, meningitis, which is an inflammation in the meninges. It can be fatal in the brain area, and cerebral palsy. Let me back up for a minute on muscular, the diseases I didn't mention, muscular dystrophy and myasthenia gravis. Those are both muscle wasting, deteriorating conditions. Okay, D is the skin or integumentary system. It's very important because it provides the outer cover for all the bones, organs, and other tissues. It serves to protect our body. It removes waste products through perspiration. There is absorption of substances such as medications, like a patch, a medicine patch that you put on. It can absorb right through the tissue and into the body system. Regulation of water loss, again, through perspiration. Regulation of body temperature, again, through perspiration. And feeling of temperature, touch, and pain. And that's through your nerve endings. Normally, they're the most sensitive in the finger areas, but you have nerve endings all throughout your whole skin. Diseases that affect the skin would be pressure sores, also known as decubitus ulcers, also known as bed sores. So we need to prevent those as much as we can. Next is psoriasis, which is just a dry flaking. It's when say normally a cell reproduces itself every 2 weeks or every 30 days. Someone that has an area of psoriasis, that cell would reproduce every 5 days or every 10 days. So there's a buildup of cells and the shedding of these cells very frequently. That's where you get that leathery looking patch of skin. And then dermatitis, inflammation of the derma, where the hair follicles are at normally. Cellulitis would be an inflammation of the cell underneath the skin. Okay, E, circulatory and lymph system. The main function is to pump blood to the entire body and to carry waste products to where they can be eliminated from the blood as it passes through the kidneys, as it passes through the liver, to get out of the body system. Diseases that affect circulatory and lymph system would be cerebral vascular accident, which is a stroke, CHF, which is congestive heart failure. That's a fluid overload, where the heart can't pump very well because there's too much fluid in the body. Or arteriosclerosis, which is the hardening of the arteries. Atherosclerosis, where there's the narrowing of the arteries. Myocardial infarction, which is MI, which is a heart attack. Angina is when just someone has just chest pain itself. And then hypertension is also in this category, where someone has high blood pressure. F is the respiratory system, and that's extremely important because that allows us to breathe air in and to take the oxygen out for our body to use it. And then when you breathe out, the air comes out that contains the waste products, such as the carbon dioxide. Diseases that affect the lungs and respiratory system would be considered asthma, which is a narrowing of the windpipes. The emphysema, which is a hardening of the pleural sacs. Bronchitis, which is an infection in the bronchial tubes, otherwise known as the windpipes. Pneumonia, which is a bacterial or viral or fungal infection that's in the base of the lungs. And then an upper respiratory infection, which is more in the back of the throat, the sinuses. G is urinary. Urinary system removes waste from the body through urine. The diseases that affect the urinary system include cystitis, which is an inflammation of the urethra, nephritis, which is an inflammation of the kidneys, a bacterial infection for both of those, and then uremia, which